Here's a patient I want to show you today that had Hallux Varus. And if you look at her foot, you can see where she has some scarring around the big toe and the second toe. She had a traditional bunion surgery done and a traditional second hammer toe surgery performed. She had a fusion in the second toe, and on the bunion, she had a bunionectomy and what we call osteotomy, which is a wedge they take from the big toe. And if you can see what happens, the toe got overcorrected. Normally in a bunion, the big toe is leaning more towards the second toe. And this surgery got a little too much correction. And this is called Hallux Varus. And the patient came in, this is the way the patient saw her foot when she looked down. You see how the toe is kind of leaning too far away from the second toe now. The patient was complaining of pulling in her toe, in her big toe, and some pulling in her second toe. Now this can be corrected, but a lot of the surgeries to do that are fairly extensive. So I had recommended minimally invasive correction to her. So what we did with her, we made a small incision on the side of her foot near the second toe, on her big toe, on the second toe side. Took a small instrument through a percutaneous incision, which is a very small incision, and formed a wedge on the bone there, away from where the original surgery was at. Now, if you look in the original surgery, you see a little wire in her toe there. The original surgeon fixated the osteotomy, or the bone cut he made, in this part of the foot, and that's probably what caused a lot of the overcorrection. And so what we did is we went away from that wire and made a little wedge you can see in the bone there, and closed that down, so that gave us a toe that wasn't so far over the other way so much. We also corrected her second toe to take some of that pulling sensation out by shortening up the proximal interphalangeal joint, or actually the proximal phalanx. So this is why we bandaged. We did this in the office, and if you can see, we'll show you what the results were. That's the results we were able to obtain through minimally invasive surgery. We're able to do this without putting the patient through a big surgery. She walked out the same day and didn't have any pain post-operatively. She only took like one pain medication. Here's how it looked pre-operative. See the big toe separated from the second toe, too far the other way. And after our little minimally invasive surgery, we got those closer together. Now she can wear a normal shoe, and all that pulling sensation was having in her big toe went away.